Head-to-toe assessment on your newborn. Is your baby's head nice and even? Do they have soft spots? Can I feel their suture lines? Is the face even while they're sleeping and while they're awake? Do their eyelids open spontaneously? When they do open, are they open evenly? Are the whites of their eyes clear? Are their ears even? Is there any abnormalities or deformities to their ears? Is there any redness, swelling, or drainage? Is the nose even? I want to see no discharge, and I want to know that they're breathing through their nostrils. The mouth. How are their lips? Are they nice and pink? What does their tongue look like? What do their gums look like? Is their palate closed? Is the inside of their mouth pink? Is it moist and intact, meaning no lesions or sores? Is there any swelling? The neck. Is there trachea in the middle of their neck? Are their clavicles even? Are they nice and smooth? The heart. Do they have a regular rhythm? Do I hear a lub-dub, lub-dub, lub-dub? Do I hear any heart murmurs? Am I hearing the sound in the right spot in the chest? I'll be pinching your baby's fingertip and letting go and making sure that the color returns within 3 seconds or less. This is checking their peripheral neurovascular system. I'll be checking the femoral pulses, the brachial pulses. I want them to be even on both sides and strong. I'll be checking to I'll make sure all your baby's arms and legs are dry and warm to the touch. In the first 24 hours, babies exhibit something called acronosis, where their hands, fingers, toes, and feet are blue. This is normal within the first 24 hours. Respiratory. Are they breathing easy? Is it unlabored? What do their breath sounds sound like? Are they equal on both sides? Moist breath sounds can be heard in the first few hours after birth as they are clearing their secretions. Nutrition. Do they have a coordinated suck, swallow, breathing while feeding? I will be testing this by getting them to suck on my finger. I am able to see if they're maintaining their color. I can feel their tongue, and I can see them swallowing. And I also make sure that they're not working harder to breathe while performing this. Are their abdomens round, soft, even? Do I hear bowel sounds? Have they had at least one stool in the first 24 hours? Is their urine yellow? Can they just pee on their own? Has there been one pee within the first 24 hours? Male genitalia. Visualize the penis, make sure it's straight. I am feeling for testes inside the scrotum. I'm visualizing any redness, swelling, or abnormalities. Female genitalia, I'll be looking at the labia majora and minora. I'll be checking for any discharge, redness, or swelling. I will be looking that your baby has an anus. I'll be checking the tone, posture, and movement of all your baby's extremities and making sure they're even on both sides. Is your baby's skin warm, dry, and intact? How does your baby's belly button look? It should have a cord with a clamp on it. It should be drying nicely. There should be no redness, swelling, or discharge or bleeding. I want to make sure this diaper is nice and folded so it is not irritating that area. I'll be looking for alertness. Are they responding to my voice, my touch? Are they drowsy? In the first 24 hours, they tend to be very drowsy. I'm looking for no excessive startles, no tremors, shaking, and no inconsolable crying. I will be also scanning the room for safety. I want to make sure that the bulb suction syringe is at the bedside and will remain there in case of emergency. I want to make sure the wheels are locked on the baby's bassinets. I want to make sure that their ID band's on and any electronic transponders that are on. I want to make sure that my emergency equipment is proper on the bedside, such as oxygen, suction. And I want to make sure that you guys are educated on safe sleep positioning.